course.
Okay. Because I will say that the pattern of appearance of your retina does look very similar to Stargardt's disease. It does. It's not a diagnosis that's very cut and dry kind of thing, and there can be variability. And although most people do have that gene positive, there may be cases where people are gene negative and still have it, but but your appearance looks pretty typical for Stargardt's disease to me, actually, in the appearance. But
and you read the thing from Dr. Sang where he doesn't think it's Stargardt's.
Yeah. So, like I said, there's some controversy, and like I said, it's not always a clear diagnosis, but from my experience, I would call it Stargardt's disease. Yeah. But basically, Stargardt's disease has certain patterns that we look for, and you do have a lot of those patterns. We see these little flecks in the back of your eye that I'll show you a picture here. These little flecks are often characteristic of it, and what's happening in your center vision while you're having so much difficulty is you have an area we call atrophy, and that is pretty characteristic of Stargardt's. Now, most people who have Stargardt's at a young age, they end up losing their center vision at a young age. But there are some cases that are more adult onset that happen later on in life. They tend to much more slowly progress. So, so it's possible that it could represent what we call a macular dystrophy, which is what Dr. Sang told you. That's certainly, like I said, it's not and given that the genetic test was negative, one could say that, it may be more that, but it does have a lot of features, so I think it's like a Stargardt's like dystrophy, if anything. But nonetheless, I think that the reason why your right eye doesn't see well is because it has this atrophy right in the middle. This is right here, this area which is basically wasted away. I'll show you your left eye.
That's right in the middle of the macula,
right in the middle of the macula. See, in your left eye, we have these. There we go. We have these flecks, but we don't have that atrophy that I was showing you there. So that's the trouble there. There's no abnormal blood vessels growing or anything like that. One of the other features that a lot of people with Stargardt's have is something we call a dark choroid, which means that the background is a little dark, and yours does look a little bit like that. But like I said, I can see that that there is some some overlap with pattern dystrophy. But like I said, if I were to look at this, that's what I would call it. But it's given that your genetic testing is negative, that is most people do have a positive genetic test, but I can't say that all of them do. But I think that's where most of the vision's trouble is coming from. So basically, because the macula is involved in this atrophy, you've got this little area that you're trying to look through that, unfortunately, this may slowly go out over time, and that's why your vision might fluctuate depending on your fixation in that eye. You do have a little haze in the capsule in your right eye.
I was going to ask you about the capsule.
And that could maybe affect why your vision pinholed a little bit better periodically. Today, you didn't really pinhole much better. I think the capsule is probably a very small factor in the vision, but I don't see any harm in getting the capsule out of the gun. It's a relatively minor procedure, and maybe that would help you a little bit. But I think the majority of the vision loss is coming from the macular degeneration that's going on there. Okay. So, because this is not a true age-related macular degeneration, there's no real knowledge whether taking vitamins is helpful. In fact, there were some reports that Stargardt's maybe it could be harmful. So I don't generally recommend that for that. People who have classic age-related macular degeneration, we do put them on high-dose vitamin therapy. But one of the top researchers in this area is a guy named Dr. Stone over in Iowa, and in conversations I've had with him, it's really not shown to be beneficial for this type of situation there. So, okay. But
so there's really not much
one can do.
They just said, given that it's the Stargardt's like. And then when I got this the option of the capsulotomy, which I'd never heard of before.
Yeah.
It kind of came up. I wanted to get it. You know, I didn't know if it was common or uncommon, but
It's very common.
It's more common than I realized.
Yeah, it's very common. I mean, many people who have cataract surgery, I would say the majority eventually get a capsulotomy
Really?
done. Yeah,
Okay.
yeah. So it's more often than not,
Mm-hmm.
and it's just a normal thing as the lens implant heals in the original capsule of the lens. That capsule starts to cloud over. Like I said, yours isn't severe, and but I think every little bit would potentially help.
Okay.
Try to help you see it. But the majority of that, and unfortunately, that macula, there's just that little dark area right there that I'm circling here.
Mm-hmm.
Is just all that's kind of left of it. So, this atrophy. I mean, I hope it doesn't, but this atrophy is likely going to progress through that area, and then you're going to be looking at that peripheral vision. But thankfully, there is some atrophy that could develop over there, but there's much less of that in your left eye than your right. So that's the
much less in my left than in my right.
much less of that atrophy in the left than the right. Yeah, so that's why you still see pretty well in that left eye there. Okay, but this was very helpful to see that, so I'm glad we were able to get those pictures.
I do that with the dyes.
Yeah, do that dye.
Yeah.
That helped.
Oh, good, and I'm glad I recorded this because my vision, those
Right,
lights and everything,
Yeah.
it's still kind of woozy.
Right, exactly.
And it also helps me when I try and explain it to people. I
Sure.
can just,
Exactly.
it's hard for me.
Is there anybody you'd like me to send a letter to or anything like that of what I found today or anything like that?
Sure, if you could, we could do it with the Dr. Weiss. All of this will be on my portal.
Yes, it will be on your portal, so you can always grab and bring it down.
I'll just do that.
Okay. All
The
right.
photos too?
The photos, I don't think they go on the portal. No, they don't go on the portal. But the interpretation of your photos will go on the
Which you
portal.
have. Okay.
Yeah. But yeah. Okay. Well, really nice to meet you, and
Yes.
certainly if I can be of any assistance.